Now, official figures show nearly 450,000 people around the world have died because of the coronavirus. What is the real number, though? How many people died, perhaps because they couldn't get treatment for other illnesses, for example? Well, a BBC investigation has looked at 27 different countries and has found that the total number of deaths caused by the virus, whether that's direct or indirect, is actually much higher than has been reported. This report by Sofia Bettiza starts in Indonesia.
A father buries his youngest son. A mother, distraught. 3-year-old Rafa did not have coronavirus, but his parents say he died because of it. He had leukemia. When his condition got worse, his parents raced to hospital.
It was around midnight. The hospital said he would need to be tested for COVID-19 before he could be admitted anywhere. Another hospital told us there wasn't a children's doctor on duty, and the quick COVID tests they had were only being used for pregnant women.
Rafa's parents drove him to 3 more hospitals that night, with no success. The next day, they eventually found a hospital that would accept him, but he died before doctors could see him.
I still believe that if my son was given prompt treatment, he would still be alive. But he was turned away and tossed from one hospital to another. I could do nothing.
Rafa is one of tens of thousands of people whose deaths are not officially counted as being caused by coronavirus, but are still victims of this pandemic. Since the outbreak of the virus, lots of countries are recording more deaths than usual. You can see a bump in the graph here. These are called excess deaths. Now, many of these have officially been linked to coronavirus, as you can see here in red. But that still leaves a huge number of lives lost, which are not accounted for in the COVID statistics. The Italian region of Lombardy saw more than double the number of deaths than expected. One of them was Luca's mother. Luciana had pancreatic cancer. When she tested positive for COVID-19, her chemotherapy was stopped immediately. But when she got better, her treatment was never resumed.
Quindi tu pensi che se lei avesse continuato con la chemio come doveva, probabilmente il suo adesso starebbe ancora con noi.
Io lo penso, ma lo penso.
Yes, I believe so, because her doctor said everything was under control, as the cancer hadn't spread to her liver. My mom was optimistic. We made plans for the future, but the virus accelerated her death. She could have been with me for many more months, or even years.
In Brazil, a similar story of grief.
My mother was a warrior who fought for her children all her life.
Andrea says that after her mum had a stroke, the hospital discharged her too soon because they needed to free up beds for COVID patients. A few days after she came back home, her heart suddenly stopped beating.
My sister tried to beat her chest, but it didn't work. At the hospital, she would have been revived. She did not die from the disease, but she died because of the disease. And so many other people are dying in Brazil and in the world that they are not counting. It's scary. It's scary.
Well, Sofia joins me now just to go through some of that. I mean, that was an interesting point. It's not just dying from the disease, it's dying because of the disease, which is obviously putting the numbers up. But I guess one of the challenges, you pulling all this together, is that, I mean, there is no standard uniform reporting system for this, is there?
No, and it took us about a month to get these figures together. Obviously, as you said, different countries have different ways of reporting COVID deaths. Some of them don't even record them if they haven't happened in hospitals. So that was, quite tricky. But what we found while looking at the figures in 27 different countries from Italy, Brazil, the UK, France, was that there's an extra 130,000 people who have died during this pandemic on top of the figures that we already know. So it's like a third higher than we thought.
And did you find that some countries were pretty close to being right on their figures and others are just way off the map?
Yes, obviously different countries, different pictures. Ecuador in Latin America is doing particularly badly, with almost sort of twice as many excess deaths than they're officially recording. And Europe, interestingly, probably not surprisingly, Italy, Spain, Belgium and the UK have been hit quite hard by the pandemic. But in Spain, we found over an extra 15,000 deaths that's officially reported. In Italy, there's up to 16,000. So yes, it's quite a significant number.
It's difficult to see beyond the awfulness of the coronavirus and the impact it's had. And yet there is a reality, isn't there, that lockdowns have actually helped to avoid a certain number of injuries, deaths. And I suppose, do you take that as a dividend of some sort?
I mean, that's really interesting because we've looked at countries like Germany, Switzerland, Austria, and they're not recording higher, sort of the excess deaths number are really, really low. The thing about these figures is that they don't really tell us why. We believe that sort of a big factor is, as you saw in the report, is people not being able to get the treatment they need, even if they don't have COVID. So sort of healthcare systems being overwhelmed. But as you mentioned, in some countries like South Africa, we've seen fewer deaths than usual since the lockdown. And that's because in South Africa specifically, they've had fewer car accidents and fewer homicides because they've sort of banned alcohol sales. So very different picture there.
Very interesting coverage there. Sofia, thanks very much for that. Thank you.